Yeah. So these are the, we call as the, rebellious rebels of diabetic macular edema, which is one of the most treatable conditions. So, in your patients, you normally expect the unexpected. You would have expected a rebellious DME which doesn't respond to your normal treatments, like you cut open an apple and you get an orange. And then our major problems which we face in India is our patients, where the patient is a rebel. He's just standing on his head rather than getting treatment when he's advised. So diabetic macular edema, as we know, is a battle of cytokines like COVID was, because DME is a multifactorial disorder, and when you have a problem, would you call a Justice League or a Batman is how I give a corollary in these treatment patients, in these patients. So progression to PDR in NPDR patients occurs in 5 years, and Ozurdex has a long duration of action which ensures compliance and controls visual acuity in these patients. As we are aware that, we have two lines of treatments, one is anti-VEGF and one is steroids. But in patients, we have seen that in the RISE and RISE, where we are using anti-VEGFs, almost 60% of the patients fail to meet the endpoint of resolution in macular edema. And the pathogenesis of DME is multifactorial. So here again, directly going to my cases, we have the rebellious patient where the compliance is very poor. Even in USA, 75% of the patients receive the first 3 injections in their first year and then they drop out, as we all aware in our practice. So Avengers of DME, what I call is like, where we have all superheroes to rescue rather than just the anti-VEGF agent, which is the Batman, which comes into play. So these are the trials which are done on Ozurdex. And this is the registry for DME, where they've shown that Ozurdex implant is also a very effective treatment along with anti-VEGF in these patients. So I'll directly go to my few cases which will make this presentation interesting. This was a 70-year-old lady with uncontrolled diabetes of 25 years. She had severe NPDR with DME. She underwent ranibizumab with laser, then cataract surgery under eccentrics cover. And then she was switched from eccentrics to Ozurdex. I'll show you all why. And she's received about 5 injections over the last 3 years. And today her vision is maintained at 612, 618. So this is how the story starts. The left eye, there was a DME with severe NPDR. Right eye also, there was DME. It responds to ranibizumab. You can see that the foveal contour has come back. Then there is recurrence in the right eye. Left eye also recurs. Then it started non-responding to ranibizumab. That's when you're stuck up your patients. You've done laser, you've done injection. It's not responding. And the left eye develops tachyphylaxis also. You can see that the macular edema is persisting. That's when we decided that we'll switch over to Ozurdex in this patient. And then that's the Ozurdex calm which we received, that the foveal contour comes back. But it tends to wax and wane. It's not that it's a, it's a panacea treatment. But this is the foveal dip which you get with steroids, which you might not necessarily get with anti-VEGF in all your cases. Left eye is tough to treat. It receives another Ozurdex in this eye. It's better now. Yesterday only the patient came back to me. The left eye is again shown up, after 4 months of Ozurdex. So it's not that it's a panacea treatment. This is again a one-eyed patient who has lost the other eye to proliferative diabetic retinopathy, is uncontrolled diabetic, received Avastin multiple PRP sessions for PDR over 9 years. He was at 660, and that's when we switched to Ozurdex. So this is how he was, You can see this opaque intraretinal fluid here, which is there. So there was no response after some time, and this is the post-Ozurdex magic. As you can see that the foveal contour has stayed. He came back last 6 months back and the fovea has remained flat. So this diabetic maculopathy is a finite condition which requires limited number of injections, unlike AMD, which is a lifetime treatment which requires treatment with anti-VEGF. So this is a 75-year-old male, uncontrolled diabetic for last 30 years, received some laser and injections. Again, a one-eyed because the right eye has undergone foveal atrophy. You can see the left eye, the extensive macular edema with a drill sort of a picture. There's a loss of inner retinal architecture with loss of RP. Also here you can see the EZ zone has started to get disrupted with VMT also. So this is how the Ozurdex calm came after an injection, when he had received injections elsewhere, but this is the response we got to a single injection at 2 months, the foveal dip. And his vision also improved. It's not just that the anatomy only comes back, even the function comes back. But then it tends to recur. Many people will say to remove this ERM, but I didn't. And it responded again well. Vision came back to 618. Again, it recurred. And then we had that COVID shutdown, where patients didn't follow up, and we lost all these patients, and they lost to, had poor vision come back. So this is when he lost to follow-up. This is again a patient who is like, 58-year-old gentleman with 30 years of diabetes. and he has received multiple Avastins and laser, and he had that persistent cyst which I'll show you, which, so this is how it starts, the story in 2012. Right eye, left eye, both you can see that cystic edema, which does resolve to Avastin, but it doesn't like totally go away, And this is the response I got to a single injection of Ozurdex, where the foveal contour came back so beautifully, in this patient. But it does recur. It again responds to a Avastin. This is a patient who developed a occult CNVM, as you can see in this patient, in a patient who was a diabetic with PRP who had done, and we again had to give him, move back to eccentrics for that occult CNVM. So this is again a post-cataract bilateral DME who received Ozurdex. You can see this is the right eye, left eye. So he had a combination of Irvine gas with DME, and this is the response we got. It came back again, but it responded very well. But these cases do tend to come back, but after few years they do settle down, and it's a finite condition. So this is a gentleman who had lost one eye to post-injection endophthalmitis, and the left eye also was having diabetic macular edema, but he refused any injection for obvious condition because he has lost one eye to an injection in this eye. So I just wanted to show you that how a good metabolic control can actually control diabetic macular edema with topical drops. So this is how you can see the response here. The cyst comes back, but this is all without any injection. Over a period of 4 years, you're seeing a patient following up with just topical therapy. The topical therapy I give is NSAIDs, prednisolone acetate, and acetazolamide drops, that is Azorb drops. Just last one patient I'll share with you. This is a teacher who underwent treatment with me, for diabetic macular edema. This is the right eye, left eye. You can see there's a subserous fluid also in this patient. So this did respond to Avastin with laser. This is in 2012, so you have almost a 10-year follow-up, but this is the foveal contour which comes back with a combination of laser and steroids, Ozurdex in this patient. Until 2021, over the last 3 years after the last injection, she has remained flat. So this condition, if you treat it well, it's a finite condition, and diabetic macular edema can be treated when you follow up the patient very closely in the acute phase when there is macular edema. So this is the foveal contour, the dip which has stayed persistent for the last 2 years without any more injections, and with a good control in this patient. So this is what I learned over a time, that these chronic cysts in a patient, this is a 10-year-old follow-up, this was a cyst in a patient, an educated patient, a subfoveal cyst, which responded to Avastin, but it came back. It used to keep coming back and never disappeared, So this is when we switched to Ozurdex, and you can see this cyst disappearing permanently. So that opaque fluid which you saw in the cyst was showing that it's an inflammatory component and responds very well to Ozurdex, and this has stayed flat for the last 4 years. So from 2018, this is how it has stayed without a single injection or a drop, So I think I'll stop at this because the time for the other session. Thank you so much for your patient hearing. Thanks.